Now that Affordable Care Act subsidies, they have expired, and Americans across the country are confronting soaring health care costs because of it. But President Trump says he's finally going to announce his long-awaited health care plan.
The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care.
But it may be too late for Americans like Andrew Ellis, who has been insured through the ACA marketplace for years. He says his health care plan went from $18 to $650 per month, leaving him wondering how the heck he's going to pay rent now. He joins me now for more. Andrew, I really appreciate you being with us.
Hi, Kara. How you doing?
I'm okay, but you hear stories like
Good.
this, for everyday Americans like you, and I'm curious, how are you going to be able to afford this increase?
Well, I'm not going to be able to afford the increase. It did come down to a decision whether or not I was going to pay rent or pay this new premium. And I've gotten quite comfortable paying a very easy premium, $20 or less for years, or almost 15 years on that plan. And so felt like the rug was ripped right out from underneath me, and I was going to be left with no choice but to cancel my health. Fortunately, I got in contact with a broker, and a broker was able to get me a different plan at a lesser rate, but it's a much less of a plan. I'm by far less insured now this year.
And that's what we heard, what was going to happen, that folks like you were either going to have to give up getting health care insurance or some type of plan that wasn't nearly as good as what you had before. Let me ask you, you teach skills to those on the autism spectrum, and you are autistic yourself. You're very open about that.
That's correct.
What are you hearing, from them? And why are these health plans so important for people with disabilities, Andrew?
Well, what I'm hearing is, and thank you for asking that too. What I'm hearing is fear and confusion, especially for a lot of my peers and students that have been caught off guard. This is especially the ones that are on their own, like myself, wanting to make something of themselves. They're scared to death and don't know what to do. A lot of them going back on parents' plans, stuff like that, going to SSI, which that's devastating to an autistic person that wants to work. We get so much dignity out of being able to work and doing a good job at work, because we will do one of the best jobs at any job that has ever been done. It's been proven, that we're extraordinarily attentive to our work. We want to work, and we want to be able to support ourselves, and in order to do that, we got to have a couple of breaks here and there, because we are not normal earners. We will not earn the normal amount in our lifetime. That is just a fact. And we're going to have some help from the government to survive in that case.
What you just said is something we've not heard on our air before, and I just appreciate how transparent you're being and really putting it into perspective, Andrew. So then I'm curious, what do you make of President Trump's potential health care plan then?
Again, fear and confusion. I wouldn't know the first thing to do to buy my own health insurance without being able to call, my Colorado division of the ACA, where they call it Connect for Health Colorado. Without them, I wouldn't know what to do. They have gotten me my health insurance throughout my adulthood. But otherwise, I went without insurance before that, from the time I was about 24, I think it was, when I was off my parents' plan, through about till the ACA started in my 30s. I had no insurance. I was still attached at the hip to my parents because I had to get money from them to get care. And the ACA brought me so much freedom and everything. It's just, I wouldn't know what to do without it. Honestly, I don't know how to buy health insurance. It is all I can do to work. And that is the case for most autistic people. we can do one thing really well, and we usually want that to be work. Most of us need help with our home life, our bills, and everything else to be successful at work too. I work constantly at home or at work because I'm constantly having to bring my work home to catch up for being behind. You know. So.
Well, I appreciate this interview so much, and we want to stay on top of your story for sure, Andrew. We appreciate you, and we'll continue to follow it from every angle. Andrew Ellis, thank you.
Yeah, thank you so much for doing this. Thanks.
You're very welcome.